So let's start with menopause. And I'm just going to tell you some of the things that I see women asking commonly about menopause. The first question that they ask is, how do I know that I'm in menopause? Another question is, I think my hormones are off. Am I going through menopause? Or my cycle seems to be off, or I'm skipping, or I'm having hot flashes. I think I might be in menopause. And so I have a very simple answer for the menopause question. And you may think that it's more difficult than what it is, but actually, what we use to determine if someone is in menopause is once their period pauses. So the period has to stop for 12 months in a row in order for that to be considered menopause. And if, let's say, you've gone 8 months and then the next month the period comes, you have to start all over with your time. Now, once someone's in menopause, meaning they've had 12 months in a row, no cycle, then if you start bleeding again, we don't call that a period. We call that postmenopausal bleeding, and that needs to be addressed. And some women don't realize that, and then they end up coming in, several months or several years later, and they tell me, oh, yeah, I hadn't had a period for like 5 years. And then I started bleeding here and there once a month. Maybe I was spotting a little bit. And I tell them, oh, we need to look into this because there are other things that can cause this abnormal bleeding, one being a cancer of the uterus. Most of the time, it's not that, but it can be. And sometimes there can be other things in the uterus, like polyps. Those are like little overgrowths of tissue, or there could be fibroids, or the tissue in the lining of the uterus could just be very thin, and that's what's causing the bleeding. So please keep in mind, if you have stopped your period for 12 months in a row and now you're starting up again, don't overlook it. Don't think your body's just kicking back in. You need to see your doctor so that they can look into it further. Now, I want to give you an exception to this bleeding issue. Some people are on birth control. And if you're on birth control, and let's say you're nearing 50 years old, because the average age of menopause is 51, you may not have periods. And so we may not be able to tell when you're in menopause until you stop that birth control. And then we can see what your body is doing naturally. The other instance where it may be difficult to tell if you're menopause is if you've had your uterus removed. So we call that a hysterectomy. And so if your uterus has been removed, and even if you still have your ovaries, you're not going to have a period where you're bleeding. And so sometimes we have to use blood work to try to determine if you're in menopause, or we try to see if you're having other symptoms like hot flashes or vaginal dryness. And then we can tell that way. So with menopause, things change. So remember, I told you stop having your cycles for 12 months in a row. Now we're in menopause. So what happens? What are the concerns that we have? Um, First of all, the risk of heart disease goes up significantly after a woman stops having her cycle and she's in menopause. And so it's very important that you're following up with your primary care doctor to check your cholesterol. If you smoke cigarettes, we encourage you not to because that can increase your risk of a heart attack. And it's good to follow a healthy diet and to exercise. The other thing that we see in menopause is that you have bone loss. So within the first 5 years of you entering into menopause, your bones start to become weaker. And so it's very important that you are taking enough calcium and vitamin D. And you can get that from your food, but sometimes you just can't get quite enough from your food. So if you want to know how much do I need if I'm in menopause for my bones to try to keep them strong, you need about 2,000 international units, so that'll say IU, of vitamin D every day. And you also need 1,200 milligrams of calcium every day. But you can't just take a one tablet of 1,200 milligrams of calcium because that it won't get absorbed in your system. So you have to divide that up. And usually we say try to get 600 milligrams twice a day. Now you have to keep in mind that you're getting some calcium from your food, which would be dairy products, or if you can't have dairy products, then it would be like almond milk or coconut milk. Those types of things have calcium. Orange juice has calcium. And then there's other foods that have vitamin D. So you want to add everything up that you're ingesting, first the food, and then you can supplement the rest to try to protect your bones. Now, remember, I mentioned exercise and how important that is. It's not only so you can have a healthy heart, but it's also so that your bones can be strong. And the types of exercises that are good for your bones are what we call weight bearing exercises, like walking. You're using your own weight to walk, and that helps your bones to remain healthy and strong. There's a test that we do actually in menopause to check the bones, and it's called a bone mineral density test. And it will let us know if your bones are normal or if they are starting to get weak or if they are very brittle. If they're very brittle, then you're at risk for having a fracture or a break in the bone. And we look at the hip bone and the spine area. And if you have a fracture or a break of a bone in your hip or your back, that can be very detrimental to the point where you won't be able to walk and the healing time can be very long. And so that's why it's so important that we educate you about prevention, because we'd rather prevent these things than for you to have to endure these things and then we have to treat them after the fact. Endometriosis. That is such a hard and challenging condition. And um, I'm praying that we can find more solutions for endometriosis. So let's talk about endometriosis. A lot of women come in and they ask me, they say, do I have endometriosis? First of all, let's define what endometriosis is. Endometriosis is where the lining of the uterus, those glands where we bleed from every month, like from the womb where a baby sits, that same tissue is found in other parts of the body, such as on your ovaries, it could be on the bowel, it could be on the bladder. I have one patient where it impacts her lungs. It traveled all the way up there to her lungs, and she sometimes has breathing difficulty with her period. Because what happens is, as you cycle every month and you have a period and your uterus starts to bleed normally, the tissue that's outside the uterus, that's in other parts of the body, it also is cycling. So women may experience pain when they're having a bowel movement, pain when they're passing gas around their period, pain with urination, painful intercourse. Sometimes they have pain outside their period, and they tell me their periods are just excruciatingly painful. Sometimes they have nausea and vomiting with it. So endometriosis can have varying effects, meaning that some women can have a lot of that tissue all throughout their body and they barely have any symptoms. And then somebody else can have just a little dot of tissue near their ovary, and then they're just doubled over in pain with their period. Endometriosis can also cause certain cysts on the ovaries that we call chocolate cysts. And those can sometimes cause pain, and in some women, they don't. So that's basically a little synopsis or summary of endometriosis. It's a very, very big topic. So there's a lot that can be said about it. But in terms of this question about whether we can use other treatments besides hormones for endometriosis, truthfully, I have not seen a lot of therapeutic, like helpful things for endometriosis outside of the hormones. Although I personally have been looking into essential oils and things to try to see if there's other ways that we can manage it. I haven't had a patient try the oils, but that is something, an alternative way to go if you didn't want to use the hormones. You could look into certain type of essential oils that can be applied to your abdomen to help with the pain. Breast pain is something that is common that we hear about. If it's involving both breasts, then we feel that it could be something hormonal and less pathologic, meaning if it was one breast that's painful, we like to look and make sure that there's nothing else going on with that one breast. If it's both breasts and we think, oh, it may be similar to what a woman feels when she is going to be starting her period or after she's ovulated, she gets this breast tenderness. And so I'll address both of them. So if we have a woman that comes in and she is having breast pain, just one breast, a lot of times we like to ask, okay, is it occurring all through the month? Is it happening just around your period? How long has it been happening? And like Anne had asked, are there any masses or bumps there? Are there any skin changes? Because if you see skin changes, like if your breast skin starts to look like an orange peel, not the color, but the consistency, that lumpy, bumpy, firm skin change, we get concerned about that. We also ask about any nipple discharge. Is there discharge coming out? Is it clear? Is it white? What have you? Is it red like blood? And so, and then we like to know, are you feeling anything under your armpit? We call that the axilla. So there's several questions that we're asking to try to figure out what may be the cause of this breast pain. And so usually what we'll do is have you come in for an exam, and we will see, when we are examining you, is the breast tender? Sometimes it is, sometimes it's not. And then we try to locate where that tenderness is. Is it involving the entire breast, or is it just involving one part? So usually when we examine the breast, we look at it like a clock. So if you look at the breast, if I'm looking right at the patient and looking at one of the breasts, 12 o'clock is up top, then there's 3 o'clock, 6 o'clock, and 9 o'clock. And that's how we document where the woman may be having trouble. And that's very important, because if we order a test like an ultrasound, then we can say, oh yes, her pain is at 3 o'clock on this side, on the left breast, and that is also where I feel a lump. Or no, I don't feel a lump, but she's tender in that area. So from there, we would move on whether we felt a lump or not. Usually we'll order an ultrasound of that breast to try to see, are there cysts there? Is there just dense tissue? So dense tissue is compact tissue, meaning if you all know what tofu looks like, or something else that kind of like butter, something really, really tight and packed. That's what dense tissue is. And a lot of young women have dense tissue. And so you may check your breast and you may feel, oh, this doesn't feel like a lump or bump, but it just feels a little firm right there. And it may feel a little tender. And around your cycle, you may notice that. That's what we call dense tissue. So that's what we're looking for on the ultrasound. And dense tissue can be a cause of breast pain. Okay. Now, so for Anne, if the doctor says you're too young to get a mammogram, which we have gotten mammograms in someone who's 35, but the issue with you is you may have dense tissue because you're young, and so the mammogram may not pick up as much. Maybe what you could consider is a breast ultrasound. The ultrasound can look for other things that the mammogram doesn't, and it can still detect dense tissue. So you may want to consider that. Now, let's say you're having breast pain from both breasts. Okay, so we go through the same process of asking all the questions, doing the exam. But again, then I'm thinking, okay, maybe this is more hormonal. Maybe it's happening around the cycle. We start asking questions also about your diet. Are you eating or drinking things with caffeine? So that's coffee, tea, even chocolate. Chocolate has caffeine, and don't forget about pop or soda. I'm in Michigan. I think some of you are out of state, so you may say it differently, but pop or soda has caffeine, and that can also contribute to your breast pain. So we start by saying, cut those things out. And usually I get a frowned face for those that love their pop or their coffee, and they're like, oh no. And then I say, well, you want the breast pain, or you want to cut out the pop and the coffee? And so usually they'll say, okay, I'll try it. The other thing I talk to them about is the actual bra that they're wearing, because ladies, we can't wear these bras forever. I know they're expensive and we may not want to buy anymore, but they do wear out. So I encourage women to get properly fitted for a bra, because oftentimes we don't even know how to wear the bra. I mean, who teaches you really how to wear the bra? We just kind of get it and we put it on and we're like, okay, I think that's right. But I learned even in the last few years that I was doing something wrong. You know how when you have your bra, and usually I'll try to tighten it to the tightest one. And that's not what you're supposed to do. When you first buy a bra, you put it on the loosest one, and then over time the bra is going to loosen up because it's going to become more elastic, and then you're going to keep tightening it and then tighten it more. So even something just as simple as that, I didn't even know myself in the last few years, because it's just something that women don't talk about. We just kind of try to figure it out ourselves. But having the appropriate fitting bra is very important. So if you've never been fitted for a bra, I encourage you to go to a department store or a bra store and let them fit you, especially if your weight has changed. Over time, our bodies change. You may not be able to wear that same bra you had 15 years ago, which we probably shouldn't keep that one that long anyway. But if you're wearing a bra that doesn't fit you well, you may have breast pain, especially if you have large breasts and they're hanging down and you don't have good support. That can cause back pain and breast pain.